In this video, we will be discussing about blood pressures, the questions and relevant PG entrance points on blood pressure. So, coming to the question side, questions on blood pressure were primarily restricted to one area, that is techniques of blood pressure measurement. Okay. So, remember we have two techniques to measure blood pressure. Number one, the conventional sphygmomanometer, and number two, intra-arterial pressure transducer measurement. Intra-arterial pressure measurement by placing transducers. We have two methods, doctors. Now, out of these two methods, intra-arterial pressure measurement is the most accurate. It is the most accurate method. It is also the value, the values of intra-arterial pressure measurements are always higher than sphygmomanometer reading. Values are always higher than sphygmomanometer, right? So, we have two techniques, one is conventional and the other one is intra-arterial pressure measurement. Remember, this is the most accurate method. Old edition textbooks, old edition materials do still insist that sphygmomanometer recorded pressures has got high values than intra-arterial pressure and sphygmomanometer is the most accurate. No, doctors, those concepts have been long gone. Remember, new edition are beyond doubts that it is the intra-arterial pressure which is most accurate and comparatively higher than the conventional sphygmomanometer pressure recordings, right. So, the question part spans around the BP cuff, okay, the cuff of sphygmomanometer. The normal cuff for each subject should be, right, it should be around 40% of arm circumference, right doctors. Width of the cuff should be about 40% of arm circumference, and length of the cuff should be about 80% of arm circumference. Okay guys, so about 80% of arm circumference should be length and about 40% of arm circumference should be width of the cuff, right. Coming to correct cuff sounds, guys, we have phase 1 which is clear tapping sound which indicates onset of systole. Phase 2 is a murmur, it is a slow murmur sound. Phase 3 increased in intensity, the sound increases in intensity as well as more crispier and sharper. Phase 4 again it decreases in intensity called as muffling of sound. Phase 5 is absence of sounds which indicates diastolic blood pressure. Doctors. This is Korotkov sound and their reference. Now, the last point you got to remember in blood pressure related questions is applications of cuff and recording of pressures. With application of a low or a small sized cuff, we tend to get spuriously high blood pressures. Okay, so conditions that causes spuriously high blood pressure is with application of small sized cuff and arteriosclerosis. On the other side, spuriously false low blood pressure is seen in large sized cuff, right doctor. Large sized cuff will give false low readings. This is how blood pressure measurements needs to be done. Remember the cuff sizes, remember increased and decreased pressures, false increase and false decrease pressures, correct cuff sound. That's all doctors. You need to be very familiar with these points regarding blood pressure. That completes our blood pressure measurement.